Yeah, my name is Lasse. I'm 57 years old. I'm from Denmark, and I've been doing a lot of sport my whole year since I was very young. I started windsurfing when I was 9 years old, and after that I became a professional windsurfer, and I've been traveling all over the world. And windsurfing is very hard with your knees and your whole core and your body. So when you make the jumps on the windsurf and you land on the water, it's a big impact on both knees. So, and I played football, I played badminton, and now, as you can see, I play a lot of paddle. So it's it's only been today, more or less, 1 year ago I had the surgery. I was thinking about getting a knee replacement because I couldn't walk. I could maybe walk 500 meter, 1 kilometer, and I had to sit down, and I feel the pain. Me and my wife, when we were on vacation and walking, I couldn't follow up with her, and I had to stay at the hotel, and it was really, really bad. I found Dr. Berger, I think, on the internet. I had a consultation with him about 1.5 years ago. He's a very kind person and very professional. He's not pressuring you into anything. It's really up to you if you want to do it or not. He is telling what everything is involved. I told him he should tell a bit more about the pain that's involved, but maybe it's just me, I don't know. I think, as I said, a lot of pain involved. But very professional, very kind person, and he's showing images on the computer so you can see what's actually will be done in your knee. And I only got, as we talked about, a partial knee replacement, and that is, as I've heard, you have a better mobility in your knee when it's just half side of your knee that's been changed. I was very strong in my whole body before the surgery, so of course it helped me a lot to do the recovery. So after these 14 days, it was like every 14 next days was a huge improvement, and it was really, I really enjoyed to see how fast the improvement went. So already after 3 months, I was playing paddle again. I think I started maybe and after 3 months, I had my first kind of game, and it went very well. And from there on, really just picked up. So there's still improvement I can do after this year, because when you have been out of the game for almost half a year, then of course you still have to come back to the game. Yeah, I have many friends that's coming up to me in my age. I'm 57, and asking me, should I do it? Should I not do it? When should I do it? I cannot play paddle anymore. I can maybe just play one game, and then and I'm telling them all, do it as soon as possible, because you can start enjoying sport and having fun and do all kind of games and play again as I like. And so that's one thing I want to tell people. For myself, it's really totally different. I don't have my calendar here, but as I remember this week, I'm playing paddle I'm starting fitness at 11 o'clock. I'm playing paddle at 5 Monday. Tuesday, only fitness. Wednesday is a very tough game where we are partners at the same level, where we go really crazy. So that's Wednesday. Thursday, it's in the fitness center again. And Friday, paddle as it is today, here in Finkenauto. And tomorrow I also have a tough game with my 2 sons. So as a father, you always want to beat your sons in a paddle game. So it's going to be fun. So that's I don't know how many times. This is 4 times paddle this week and 3 times fitness. So it's really, really. I really enjoyed being back in playing and doing sport on that level. at Dr. Berger, and he told me about the whole procedure and so on. I went home and I was thinking about it, talk it through with my wife, and we sent him a WhatsApp message and said, let's do it. And I had a time in the book, and I came to the hospital that was on the HC Marbella hospital, which is almost like a good hotel. And I went to the surgery, and you don't feel any pain at all when you have the surgery, not at all. You can't feel strains there. You can see they're pushing your whole leg, and you see your leg out there and think, what is going on? But after that, I went to the recovery area, and after that I went to my hotel room almost, and I stayed there, I think, for 2 days. I didn't went home at the same day. I know that some patients do, but I stayed there for 2 days because I was in a lot of pain. Dr. Berger, he came, and I asked him what's going on, why is it so painful, and he was really kind and explained to me that I'm still a young patient, and some younger patients have more pain than the older one. And after that, I was in contact with the hospital. I had a few check in the first 3 months, and then after that it was from these 3 months there went almost another 9 months for the 1 year checkup. And there was I didn't contact him at all, because in these 9 months it was just doing better and better and more recovery. I had this 1 year checkup just what was it, 3 weeks ago, something like that, and everything was fine, and he was really happy about how much I could bend my knee and stretch it. And so yeah, he is really kind and really professional, and I really trust what he's saying, what he's doing.